Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Zingle. Are you struggling with Parkinson's, dystonia, or essential tremors? Then you're in the right place, and thank you for joining us. Living with Parkinson's disease or other movement disorders can be life-changing, but with the right care, patients can manage symptoms and improve their quality of life. Today, Dr. Gary Vokel, a board certified neurologist, fellowship trained in movement disorders, is joining us to discuss these conditions. Dr. Vokel specializes in the care of patients with Parkinson's disease, dystonia, Huntington's disease, and tremors. Dr. Vokel, welcome. Thank you for being here with us today.
Thank you for having me.
Of course. Before we get into our questions, can you tell our viewers a little bit about yourself?
Sure. Yeah, I'm originally from New York. When I did my medical school in New York, and I did my medical training, my residency and fellowship in Albany, New York, and I came to Maryland to work for MedStar Franklin Square in July of 2021. So I've been here for just over 4 years. And as you already mentioned, Karen, I specialize in movement disorders. So I'm a neurologist, but my focus is on diseases like the ones that you mentioned. So things like Parkinson's disease, tremor, dystonia, Huntington's disease, restless leg syndrome, things like that.
All right. Well, thank you very much. Let's get into those questions. Let's start with the basics. Can you tell our viewers what a movement disorder is?
Sure. So movement disorder is when somebody has usually a disease that is causing an injury to the brain that causes a change in the way people move. And that could be maybe how coordinated they are. So maybe they become more clumsy. It could be how they talk. Maybe they started slurring their speech. It could be their ability to walk around and move. So they could be falling more. It could just be that they're slowing down or having a tremor, things like that. And those diseases usually happen because of an injury into very specific parts of the brain, like the basal ganglia.
All right. Thank you. So, what is it like living with a movement disorder?
So it can be, depending on the movement disorder and depending on how severe it is, it can be manageable or it could be more challenging. So some movement disorders are very mild, and they can be annoying, but they don't shorten somebody's lifespan. They don't kill people, right? They're just kind of a nuisance. And for diseases like that, it could mean that the person gets monitored and doesn't need any medicines at all, or it could mean that they take a small dose of the medicine. So that's sort of one end of the spectrum. And then there's a more serious end of the spectrum where somebody could have a disease that has no cure that gets worse with time. And for somebody like that, that disease, especially a movement disorder that's doing that, can cause movements to get more difficult and challenging. And that person may end up needing something like a cane or a walker or even a wheelchair to get around. They may need help with some of their daily activities, whether it's managing finances, doing household chores, or even things like helping to get fed, for example. So it could go from kind of a nuisance to something very serious that really affects the way people do their daily activities.
Thank you for that. You mentioned tremors. What are the other symptoms that a patient would experience who has a movement disorder?
Yeah, so a bunch of these movement disorders can cause tremor, and a bunch of them don't. So something like Parkinson's disease can cause a whole bunch of different symptoms, including symptoms that affect the way people move and symptoms that affect other stuff. So we call them motor symptoms and non-motor symptoms. Motor symptoms would be things like tremor or getting rigid and having more difficulty moving, or having slower movements, or changes in the way they walk and keep balance. And then non motor symptoms are things like constipation or confusion or a loss in the sense of smell. There are other diseases where movement disorders, which can cause kind of like muscle cramping or spasming or like tightening up, which can cause some abnormal movements, like you said, tremor, or kind of funny posturing where maybe the hand is twisting in a different position. So those would be examples of some of the other types of movements that people may experience or feel.
Mhm. Okay. So, what are the treatment options?
Yeah, so it's going to vary from disease to disease. Um, Probably the most common thing I see is tremor, and the main cause of tremor that I see is called essential tremor, which is one of the ones that you mentioned in the introduction. Essential tremor is a condition where the hands start to, usually it's both hands start to tremor like this, and that can just stay in the hands, or it can spread to other parts of the body like the neck, the voice, the head, or the legs. Doesn't have to, but it can. And with a tremor like that, if it's not bothering somebody, we don't have to treat. If it is bothering somebody, there's usually oral medicines that are available. And in more severe cases that are really disabling and are not responding well to the medicines, then there are neurosurgical options, things like deep brain stimulation and something else called MRI guided focused ultrasound. That would be, for example, essential tremor. With other diseases, there are different oral medicine therapies. Sometimes there are different surgical therapies or even infusion therapies that can be offered, including pumps that people may carry on their person, and it just goes right underneath the skin, the needle, and it just pumps the medicine into them for the whole day. So there's a lot of different variations. And for dystonia, which is one of the other ones you mentioned, that's actually usually treated with a few injections in the clinic, and that's something that's done in our clinic. So kind of a big range of different treatments, but it's very dependent on what the disease is and what the person's symptoms are.
All right, thank you. Yeah, I want to talk more about deep brain stimulation. But before we get to that, how do those treatments improve a patient's quality of life? You mentioned challenges earlier. So, what benefits do those treatment options have?
Yeah, so the most of the time we are really trying to help improve quality of life for somebody. So most of these diseases are things that are limiting mobility or interrupting our normal movements in some way that is can be frustrating. Um, and the medicines, all the therapies are really designed to try to reduce the abnormal movements and make people feel more like how they were before they started having those abnormal movements.
Mhm.
So if somebody's having a tremor and it's making it hard to pick up a cup of coffee, for example, and bring it to their mouth without shaking or spilling it, a medicine may reduce the tremor. So a task like that becomes easier, easier to manage and more like an everyday thing like how it was before the tremor. That's usually the goal of these therapies is to really try to reduce the movements or any discomfort or pain or something like that coming from one of those movements.
Very good. Thank you. So, let's talk more about deep brain stimulation. What is that?
Yes, so deep brain stimulation is a type of therapy which is used for a number of different diseases, some even beyond what I do with beyond neurology. But I typically am using it for diseases like Parkinson's disease, essential tremor, and some types of dystonia. It's broader even in the world of movement disorders and even in neurology and even beyond neurology. But those three are the ones that we've been doing for longer in many respects. And it involves a team that helps with the person who is talking about this. So if they have, let's say, Parkinson's disease, they'll have a neurologist, a movement disorder specialist like me. There'll be a neurosurgeon, so a brain surgeon who can help with doing the procedure of placing the deep brain stimulation, and also somebody like a neuropsychologist who is able to do some evaluations for the person before a procedure like this. And the reason is that you'd want a movement disorder specialist first to make sure that you have the right kind of disease and that the person is a good candidate. And they would work with that person to say, you know what, I see you have, in this case, your Parkinson's disease. It really seems like the other therapies we were doing aren't helping quite as much as we had hoped for, or something else where we just really feel like you'd be a good candidate for deep brain stimulation. Let's check a few things out and make sure that if we went ahead with this procedure, you'll do okay. So there'll be some testing that's done with the neurologist. That person will get evaluated by a neuropsychologist just to get some baseline understanding of how the person thinks and behaves. And then they'll also meet with a neurosurgeon who will do some testing and some head imaging. Then what will happen is if the person is a good candidate, they go to the operating room with the neurosurgeon, and the neurosurgeon will open up a piece of the skull. So they'll remove some of the skin, they'll open up the bone, and then it involves the placement of kind of like a long metal wire that goes into a very specific spot in the brain. That metal wire, sometimes it's done on both sides, so sometimes it's two metal wires, is then connected to like a battery pack that gets implanted in the chest, kind of like how a pacemaker would for somebody with a heart problem. All of this stuff is under the skin. You can't, it's not outside. You can't really see it. But you may see something like a bulge, like how you might see a bulge of a pacemaker. You might see the bulge of the battery, for example. Um, and the way that it would work is, and then of course the person gets closed up, right? We don't just leave everything open. But this battery can be programmed with like a tablet. So if you've ever seen, one of those tablets, like some kind of pad or whatever, it connects to the battery, and we can set different settings on this battery to allow electricity to leave the battery and go up those metal wires into a very specific part of the brain. And that electricity is allowed to very carefully leave the metal wire into the target area of the brain. And that when that happens, it can help improve upon different symptoms. So in the case of Parkinson's disease, when the device is turned on and the electricity is at a good setting, that person's slow movements may speed up a little bit. Their tremor may subside. Their rigidity or stiffness may also get better. And what's nice about that too is this having a device like this can sometimes reduce how many oral medicines the person needs to take. Maybe not get rid of all of them, but reduce how high of a dose they're taking, which can be nice because when people are on very high doses of medicine, they can start to have side effects. So this may improve side effects and really help improve that quality of life if it's improving on those symptoms. And it's sort of a similar idea for tremor and for dystonia, where you're going to have a team and the goal is to place a metal wire and let electricity run through it into the brain to improve on the symptoms that the person is having.
Wow. Thank you very much for that explanation. That's incredible.
Yeah. Sorry,
Well,
it's a lot.
no, it was good. It was very comprehensive and thorough, and what our patients could expect out of this surgery, and how they would be determined to be a good candidate for it. Can you tell me a little bit about what happens after the surgery? Is there specific follow-up, and what does the long-term outlook look like for someone after they have DBS?
Yeah, so in most of these conditions, so for example, Parkinson's disease, essential tremor, dystonia, these are conditions that don't have a true cure. So we're really managing the symptoms. Um, so long term, if this is a disease that gets worse with time, like Parkinson's disease, even with something like deep brain stimulation, those symptoms will get worse. Now, what's nice, like you're kind of alluding to, is that deep brain stimulation is something where it can get programmed over time. So somebody who has a device initially after the surgery will come to my clinic, for example, at least once a month to make small adjustments, and as we fine tune the electricity going into the brain. Each time we make a change, we want the brain to kind of adjust and get used to the new settings. And we do that little by little until we find a good setting for the person. Then they may just be following up like how any person may follow up with their neurologist when they have a disease like this, maybe every 3 months, maybe every 6 months, things like that. Long term, if those symptoms are getting worse with time, those settings can be adjusted further. Now, again, this is unfortunately not a cure. So eventually, with with all these things, with medicines and with the stimulation from the DBS, we may find that we reach a point where we're sort of at the maximum efficiency or the maximum efficacy of, I should say, of the device and the medicines. But that usually takes a long, long time over the course of many, many years before we reach something like that. So long term, this is a device that can be very helpful and can be adjusted over years and years and years and years.
All right, great. Thank you so much. We did get a question from our audience. Thank you so much for joining and asking your questions. This question is about functional movement disorder.
Mm-hmm.
Can you talk about what that is? And is that something that we treat at MedStar Health?
Yeah, it's a really good question. So functional movement disorders are movement disorders that are not coming from a disease in the brain, like an illness where the brain is getting injured, but usually from something else. So we typically think of this falling along the lines of, instead of it being a neurologic process or being a psychological process. What I mean by that is everyone has different coping mechanisms. Everyone does. So when our body is under stress, which we all unfortunately get to experience in our life, whether it's a physical stressor like, oh, I'm sick, or whether it's I'm in pain, I'm sleep deprived, I'm really dehydrated, or an emotional stressor, death of a loved one, or work has been really challenging, or something. We've all experienced that. Our brain and body has all different kinds of coping mechanisms. We don't really get a say in it. Our body just kind of does it for us. So for me, if I'm under way more stress, my stomach may hurt, right? I may have to go to the bathroom a little bit more. Other people may get a little bit nauseated. Some people may get lightheaded or even have headaches. There's all different things. I mean, if you're listening, you know what yours is probably, right? Everyone's been stressed. Everyone kind of knows their body does some interesting stuff that we don't have control over.
Mhm.
And with a functional movement, it's the same idea, but those stressors have caused the person, instead of maybe having an upset stomach, or something like that, maybe they get a tremor instead, or maybe they start to look like they have a movement disorder, like Parkinson's disease. Fortunately, there isn't a change to the an abnormality in the brain like a disease causing it, but these other stressors have caused these movements to occur. Um, the good thing is that these are things that are reversible, unlike Parkinson's disease, where we don't have a cure. And it usually just is a matter of meeting with somebody like a neurologist and somebody like a mental health specialist, whether that's a psychiatrist, a psychologist, or both. And between these teams to help um, try to alleviate whatever those stressors may be, or figure out and make sure that there isn't something else going on, like a neurologic process. And usually, through a combination of those things, a functional movement disorder can improve with time. That's the hope, at least. It can be challenging to treat as well, though. I would say, yes, these are things that are treated in in MedStar sites, but it's usually not just going to be one person who's doing it, like one neurologist. It's usually a combination of a few different people to try to address the different kinds of things that are going on. I hope that answers the question.
Yeah, yeah, thank you. And thank you, Linda, for that question. Really appreciate it. Um, what else would be helpful for our viewers to know about treating patients with movement disorders?
Um, well, so again, it's all going to be different depending on what the movement disorder is. But probably one of the important things is if something is changing and there's not a good answer, to meet with a doctor, hopefully your primary care provider, who can then get you seen by somebody like a neurologist or a movement disorder specialist specifically to be evaluated. So if there's a question about a movement disorder, it's always nice to get evaluated by an expert who can then let you know what they think is going on. And then that sort of helps with what kind of treatments will be available.
Mhm.
So certainly getting seen and evaluated and then discussing different treatment options is the first thing, making sure that we have a good diagnosis in place first.
Mhm.
And then for the approach, things to know, most of these things don't have a cure, but there are treatments available. So keeping that in mind, that while it's always scary to hear that you may have a disease that doesn't have a cure, to know that there are usually treatments available to make things better. So to have that in mind, that diagnosis of a disease does not mean that everything's over and done. There's different therapies and things that can be offered. So to have, I'm an optimist. So having that in mind, just knowing that just because there's a diagnosis doesn't mean that there isn't something that can help.
Yeah, sure. You mentioned the different treatment options earlier. Is there anything else that patients who are living with a movement disorder can do to improve their quality of life outside of medication? For example, exercise or anything else that you would recommend?
Great question. Yeah, absolutely. A lot of times, some kind of aerobic exercise, so that's something that gets the heart racing a little bit, whether that's walking, running, using a stationary bicycle, dance, tai chi, swimming. There's other exercise programs that are offered, including certain boxing programs. Um, that is something that we know helps promote good brain health in general, but can also sometimes help with movement disorders.
Hmm.
Um, like in for the example for Parkinson's disease, that's a disease that slowly gets worse with time. Doing aerobic exercise like 30 minutes 3 days a week has been shown to slow down the rate of disease progression. Um, and most people who have a movement disorder, especially one that is very impactful on the person, um, it is very common to be seen by a rehab specialist, somebody like a physical therapist or an occupational therapist or a speech therapist sometimes if it's changing, if the movement is changing how they're talking or how they're swallowing. So yeah, these kinds of physical activities are usually a really important part of taking care of somebody beyond just medicines or surgery. Absolutely. In
Mhm.
fact, they usually come first. So
Okay, that is great. So, with that, I mean, you've answered my questions and our viewers' questions. What else do you want to share with our viewers before we wrap up our broadcast today? What do you want them to take away or remember? Anything else to add?
yeah, well, certainly, definitely, if you are concerned that you could have a movement disorder or a neurologic problem, asking to meet with a neurologist, a movement disorder specialist, and keeping in mind that for a lot of things there are treatments available. So not to give up hope, but to explore the options with somebody who is familiar or specialized with the treatment options and that diagnosis. So definitely that I would recommend that. Other exciting stuff from my standpoint is earlier this year in April, which is Parkinson's Disease Month. We hosted our through MedStar. We hosted our first Art Moves event, which was a really fun event where we had people with Parkinson's disease coming in, doing some exercise with our rehab specialists, and then doing an art project with one of the local artists in Baltimore, Asho Buckingham, and it was great. You can kind of see the bottom of the one that I made. It was a nice, fun splatter piece. We're going to be doing that again in this coming April 2026. Right now, the tentative date, although probably the permanent date, is going to be April 17th in 2026. And that's something where as we get it more fleshed out, we'll be sending out flyers and things like that to make sure everyone is aware that it's happening. But we would love to have people join us and do another exercise session and fun art event.
That sounds wonderful. I love that. Art moves. That is, if you're thinking, thinking about your movement disorder, probably in perhaps not the best way. As you mentioned, you're an optimist, and that is a wonderful place to be, especially when you're experiencing something like this. So, thinking about your movement disorder in a positive way by moving your body and the art moves event, I think, is something that our viewers will definitely be considering.
Yeah, yeah, I know it's no fun to have one of these diseases where our movements are affected, but I really wanted this. It's free. I wanted to give back and just remind people that just because you have a disease doesn't mean you can't do things that you love or that you may not have tried before that you may learn that you love. So this is a nice way to remind everyone that anyone can do art. And it can be a fun thing for anyone, no matter what's going on in their life. So I loved it this year. I think it's going to be great, even better this coming year.
That's wonderful. Well, thanks for sharing that. And thank you so much for the time and sharing your expertise. I know you're extremely busy. We really appreciate you being here. And thank you to our viewers for tuning in.
Thank you so much for having me. This is great.
Of course. And we hope that our viewers got a better understanding of movement disorders and treatments that are available to help improve quality of life. If you would like to learn more, you can call 443-777-7320. That's all the time we have for today. Thank you so much for joining. We'll see you next time.